spectrum. We'll begin with Dr. Mahesh, and we'll go as the speakers come in and the audience as well. Thank you.
Thank you, Chaitra. So we will start. My talk is on retinal findings in lifestyle diseases. Till now, I know only a couple of diseases that are considered as lifestyle diseases, like diabetes and hypertension. So I was just going through that. There are a lot of ocular diseases due to ocular changes due to lifestyle diseases, but my talk is specifically on retinal findings. So I will go through some of the diseases. The retina is supposed to be the window to systemic diseases. You can see the retina and diagnose a lot of things. Can be congenital or acquired anomalies. Like this is a normal fundus. All of us know what is a normal fundus, and there are a lot of findings like Weibern-Mason syndrome or coloboma of the optic disc with midline anomalies, hemangioma with Sturge-Weber syndrome, then von Hippel-Lindau with so a lot of things are there which will be covered in the future talks. And there are a lot of acquired conditions like hematological conditions that will be covered, vascular conditions, inflammatory conditions, and even malignancies, neoplastic like metastasis. And these are some of the vascular occlusions, cytomegalovirus infections, then hematological conditions like leukemia. So a lot of acquired conditions. My talk is on lifestyle diseases, and I have to cover a few diseases which are called lifestyle diseases, and there are diseases like AMD and other RVO, etc., where it is related to poor lifestyle choices. You cannot call it lifestyle diseases. Lifestyle choices like poor diet and smoking, what I am going to cover is few things like hypertension, hyperlipidemia, and diabetes, where I will show some pictures. So, Dr. Gopal is here. Thank you. Thank you for giving us the opportunity. So, I will go through some of the hypertensive manifestations. There are two types of manifestations in the retina due to vascular retinopathies. One is hypertensive retinopathy, otherwise arteriosclerotic retinopathy. If there is no arteriosclerosis and suddenly the blood pressure shoots up, you can get hypertensive retinopathy. That is mainly in young people. And in elderly with involutional sclerosis, you can have arteriosclerotic retinopathy, over which hypertensive changes are superadded. The important thing is malignant hypertension, where we have diagnosed a lot of cases of malignant hypertension just by looking at the fundus and then checking your blood pressure. We have saved a lot of people like that. All of you might have seen cases like that. I am not going into the classification of hypertensive retinopathy and arteriosclerotic retinopathy, but you can get ischemic optic neuropathy due to nocturnal hypotension. Then there can be arthritic type of ischemic optic neuropathy, which are also systemic manifestations. That is not lifestyle diseases. And malignant hypertension, you can diagnose the disease and be life-saving. Like this disc edema, multiple cottonwool spots, and some of these cases have macular star. This is another case, acute disc edema resulting in peripapillary hemorrhages, and sometimes you can get choroidal infarct. This is not usually seen in pure hypertension. This was a case of eclampsia, accelerated hypertension in a pregnant lady, leading to choroidal infarct and even vascular occlusions. So these are cases where you can diagnose hypertension based on the retinal findings. You can have a patient with tributary vein occlusion or even retinal artery macroaneurysms, and this is another retinal artery macroaneurysms seen in cases with hypertension. So these are some of the manifestations due to hypertension in the retina. Sometimes you can get retinal artery occlusions in hypertensive patients where there is a dislocated plaque leading to arterial occlusion. You can get this retinal artery occlusion with cilioretinal artery sparing and branch retinal artery occlusions, especially if the emboli consisting of platelet or cholesterol emboli. So this drug abuse is another cause where you can get CRAO. Now coming to the second disease, that is lifestyle diseases, hyperlipidemia. This is a classic hyperlipidemia, purple fundus it is called, and I will show one case that is enough. This patient came in 2024 with, the picture is like this, plenty of hard exudates, lipids across in the posterior pole, especially the nasal side also you can get, not like a typical diabetic retinopathy, and hyperreflective dots in the retina, even at the fovea, and angiogram shows NPDR changes with diffuse capillary leakage, and patient had a, this is the angiogram, no new vessels, so NPDR with the, so patient had hypertriglyceridemia with hyperlipidemia. The triglycerides was more than 600 with total cholesterol also very high, and just without doing any injection or laser or anything like that, we just started sent to and we just started anti-lipid this thing, and gradually you can see the exudates all cleared. A patient was given fenofibrate or rosuvastatin combination, and over 1 year it has become like this, absolutely gone. So this is the importance of checking hyperlipidemia in a case of diabetic retinopathy. And now the biggest menace is diabetic retinopathy. It is the most important lifestyle disease affecting the retina, and all of us, mostly half of the patients that we see in on OPD is diabetic retinopathy. The findings, you can get a maculopathy or a PDR, and the course and prognosis is different. One is blinding, one other is visually causing severe morbidity, and sometimes the DME can be having good outcome, but not always. There are recalcitrant cases depending on the systemic metabolic control. There are diabetic retinopathy with systemic implications, like these cases I told. The hard exudates are lipids are much more due to hyperlipidemia, and the other one has uncontrolled hypertension due to and plenty of cotton wool spots. So systemic implications are there in the finding, and sometimes it is vision is 6/6, very advanced diabetic retinopathy, and they all wake up after bleeding. And you can get good vision with a lot of fibrous tissue. If you touch the eye, it is likely to worsen over time. So this is tractional detachment and combined retinal detachment. And there is a small entity called diabetic papillopathy, which is ischemic optic neuropathy in diabetic, uncontrolled diabetes. So these are, and smoking can also result in AMD, different types of AMD, and rarely smoking can lead to lung cancer and findings in the retina as metastasis. So these are all some rare causes, but related to lifestyle. So a simple fundus examination can give invaluable information about the underlying systemic disease, and some cases we can prevent systemic complications and improvement in the quality of life, especially cases like malignant hypertension. Thank you.
Thank you very much, Dr. Mahesh. Thank you, Chaitra, for introducing the topic to us, and Mahesh for starting up with lifestyle diseases, which is very commonly coming up in India. So more than 60 to 70% people have either diabetes or hypertension or hypercholesterolemia, dyslipidemia, etc. And since these common lifestyle diseases are picking up, and eye is a morphological way of picking these up, we will go a long way in picking up eye signs to look at the severity of these diseases. The challenges would be, one, to pick up these diseases before visible morphological changes like hard exudates or soft exudates or such changes come up. And so that is what a lot of people are working on. And then that AI has revolutionized it, and using these images, can we pick up any of those diseases on a screening basis or for triaging them? So are there any questions here? We can go 1 or 2 questions and then move to the next talk. Are there any questions from the audience? Mahesh, you can join me here, please. Any questions? Okay, Mahesh, let me ask you. So before visible changes develop, can you think about certain paradigms where you can think about predicting these diseases, like vascular changes or vascular surface area? Has there been any work on that, the branching patterns?
Yeah, actually OCTA has detected choroidal vascularity index and all other findings which can predict systemic morbidity like hypertension and even lifespan of the. A lot of AI-based technologies are coming, but we don't do that in a clinical setting. That is the only thing. I have.
Okay. Thank you very much.